All right, labral tears at the hip. So kind of like the shoulder as well, there's a ring of cartilage that is on the outside of the socket. So unlike the shoulder, the hip is a little different. So you have a ball and then you have a socket that kind of envelops the ball. So it's a little bit more of a deeper socket. And this labrum is a ring of cartilage around the socket which helps keeps the ball in there. And occasionally that labrum can get torn. So that ring of cartilage can get torn. Now, my wife, who played Division I soccer in college, she was diagnosed with pain on the front of her hip, which the athletic trainers called a hip flexor strain. And I guess this was a chronic strain because she had it for 2 years and it just didn't get any better no matter what she did. Hurt when she walked up hills, hurt when she would walk up steps, hurt when she sat down for too long. You get pain right in this groin area here, okay? Just hurts here. And oftentimes that's what happens. It gets this problem, this tear at the labrum gets diagnosed as a hip flexor strain because it hurts with the same kinds of stuff. So it needs to be specifically teased out with special testing, either from a qualified orthopedist or orthopedist and sports medicine guy, or a qualified sports physical therapist. So I was the one to diagnose my wife. After 2 years, I saw her once for an exam and I said, hey, I think you're going to need to go see somebody else. So I referred her to a surgeon. She got an MRI with contrast with an injection. It showed that she had a labral tear, was referred for surgery, and that's how that went down. But not all labral tears need to be managed surgically. Sometimes they can be managed conservatively, increase the strength, increase the stability, increase the length of muscles around the joint. It's worth a shot.